Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, so we all pretty much accept that exercise is good for our mental health, right? It feels like a
Yeah,
given.
definitely.
But what if it's not just about how much you move? What if the how, the where, even the why you're moving is actually what really matters?
That's the big question, isn't it?
Welcome to the deep dive. Today we're digging into the sources you sent over. A really interesting health news piece from Neuroscience News, and also this detailed scientific paper up for debate. Does regular physical activity really improve mental health?
Yeah, it's a fascinating set of materials.
Our mission here is to really explore these, challenge that old sort of dose response view, more exercise equals more benefits, and instead shine a light on context. It seems like this huge, often ignored factor.
Absolutely. Context is key.
So you're going to find out maybe why hitting the gym might feel different from, say, gardening. Learn about some limits of past research and hopefully get some ideas on how to think about movement in your own life for, well, maximum mental well-being. All right, let's unpack this a bit. For years, the whole conversation around physical activity and mental health, it really felt like it was all about the dose. Like, how long did you work out? How hard? How many calories did you burn? It was all numbers.
It really was. And, it's interesting. The idea itself goes way back. Ancient Greece, Hippocrates, they knew there was a link.
Right.
But modern research, especially when it really ramped up in the early 2000s, yeah, it overwhelmingly measured exercise by volume or intensity, basically how much work you did.
So the assumption was, look, just get enough movement in, any kind, really, and the mental perks would just follow.
Simple as that,
right.
pretty much.
Yeah.
But this is where this new research, this perspective from the University of Georgia study, based on that 2023 ACSM colloquium, really shakes things up. Well, it directly asks, is it truly just about the quantity? And the summary is pretty clear. The mental health benefits seem to depend not just on the amount, but really significantly on the context where the activity happens.
Okay, context. What does that actually mean here? Give me some examples.
Well, the sources break it down.
Okay.
Voluntary stuff, things you choose to do for leisure, like yoga, maybe playing a team sport, going for a run, because you want to, those tend to boost mood, much more than obligatory things.
Like housework.
Exactly, like housework, or maybe physical labor you have to do for a job. The feeling is different.
That makes intuitive sense, actually. And there's more.
Oh, yeah. Get this. Factors like who you're with, so social interactions, the environment, are you outside in nature or in a crowded gym? Even the style of the instructor, if you have one. All these things can apparently profoundly influence how exercise hits your mental state.
Wow. So it's the whole package, not just the physical motion.
Exactly. The researchers looked at 3 kinds of studies to figure this out. Big population studies, epidemiological ones,
Right, looking at trends.
then those controlled experiments, randomized controlled trials, or RCTs,
Okay.
and also studies that specifically zoomed in on these contextual factors. The aim was really to get past just the like running versus swimming, and dig into the how, where, and why. So if we start with those big population studies, the epidemiological evidence,
Right.
well, it strongly backs up the idea that regular leisure time activity is linked to less depression, less anxiety.
Okay, so that part holds up.
It does. There's a lot of robust observational evidence there built up over years.
But you said it wasn't always more is better.
Right. Even in those large studies, it gets nuanced.
Yeah.
The paper mentions this L-shaped relationship for depression. Benefits go up, up, up,
Yeah.
and then they just plateau. More activity doesn't necessarily mean more benefit beyond a certain point.
Interesting. Plateauing, not getting worse.
For depression, often yes.
Yeah.
But some studies even hinted at a U-shape, meaning like very low activity and very high activity could both be linked to more depression compared to moderate levels.
Huh. Too much could be bad. Why?
Well, think about elite athletes and overtraining. That can definitely lead to mood problems, burnout.
Sure.
And then for a small minority, really high levels of exercise can sometimes be tangled up with things like exercise addiction or eating disorders. So it's not universally positive at the extreme end.
Okay, so that raises a huge question then. Does all physical activity count the same for your mental health? Like, does scrubbing the floor give you the same boost as going for a hike with friends?
That's exactly what the paper questions.
Yeah.
And the evidence seems to suggest probably not. Leisure time activity, the stuff you choose to do, has the strongest backing.
And the others, like work, getting around, chores.
Occupational physical activity, transport activity, household chores. The paper says they might not give you the same mental health benefits. It seems the why matters.
Wow. Are there specific examples of that difference?
Yeah, and it connects to socioeconomic factors too, which is really important.
Yeah.
One study they mentioned looked at older Latino adults.
Mhm.
Higher household physical activity chores basically was actually linked to more depressive symptoms in that group.
More, not less.
More. But higher leisure time physical activity in the same group was linked to fewer symptoms.
That's a stark difference.
It really suggests that the purpose, the feeling behind the activity, is it drudgery or is it enjoyable, might be crucial for the mental health outcome. Voluntary versus obligatory seems key.
So for some people, just telling them to be more active might miss the point entirely if that activity feels like another burden. We need to think about how it makes them feel.
Precisely. It's about the quality of the experience, not just the quantity of movement.
Okay, let's shift gears then. What about those super controlled studies, the randomized controlled trials, the RCTs? Do they give us a clearer picture? Do they consistently show exercise improves mental health?
Well, the short answer is yes, mostly. They do generally show improvements in clinical symptoms, like for depression and anxiety. Things tend to get better.
Okay, that sounds promising.
But, and it's a significant but, the longer answer is, well, it's more complicated. A lot of these trials are pretty small. They don't run for very long. And often, the participants are already fairly healthy, or maybe from higher socioeconomic groups, which makes it harder to generalize the findings to everyone.
Right, not necessarily representative.
Exactly. And there's another big methodological headache.
Which is?
Blinding. It's almost impossible to blind someone to whether they're in the exercise group or the control group, if you're exercising, right?
Yeah, obviously.
So if you expect exercise to help you feel better, that expectation, kind of a placebo effect, could be a huge factor. Some estimates suggest it might account for maybe half the benefits seen in shorter studies.
Half, just from expectation.
Potentially, yeah. It's a powerful thing.
And the paper mentioned other challenges for these trials too, didn't it?
It did. Like spontaneous remission. Sometimes mental health conditions like major depression just get better on their own over time.
So a short study might see improvement and credit the exercise when it might have happened anyway.
Exactly. Which is why we really need longer, bigger studies.
Yeah.
But those are tough, expensive, hard to run.
Okay, so summing up the RCT evidence then.
Basically, yeah, hundreds of studies show overall benefits, especially for clinical symptoms. But the average effect size, particularly for general mental health in people without diagnosed disorders, is often quite small.
Small enough to question things.
Well, it leads the paper to ask that pretty provocative question.
Yeah.
If every exercise intervention seems to work a little bit, does any specific exercise truly work in the sense of causing the outcome?
Meaning maybe something else is going on besides just the exercise itself.
Precisely. It really pushes us to look beyond just the dose and consider, well, context again.
Right. This is where context really takes center stage, isn't it? The thing that's always there but often ignored. It's not just the movement, but everything else.
Absolutely everything else. Context is always present. It's who are you with? Are you alone? With friends? In a supportive group? Where are you? A park? A gym? You're a basement? What's the weather like? Air quality? The whole social atmosphere? Even, as we said, the instructor's vibe.
It's a lot of variables.
It is. Even things we think of as solo, like gardening or walking to work, they still happen in a context. The neighborhood, the time of day, the feeling of safety.
Yeah.
It all shapes the experience.
Does this study give concrete examples of context making a difference in trials?
It does. There was one really striking example with kids who had ADHD and disruptive behavior disorders.
Okay, what happened?
They set up an exercise trial, but found that just telling the kids to exercise wasn't enough. They wouldn't do it.
Right, typical kids sometimes.
Yeah. So to actually get them engaged, the researchers had to bring in established psychological techniques, behavior management strategies, positive reinforcement.
So they changed the context of the exercise.
Exactly. And the kids' mental health improved. But was it just the physical activity, or was it the activity plus the supportive, reinforcing context they created? Likely both. The context was inseparable from the intervention's success.
That makes total sense. What about social context, like team sports?
Yeah, that's a big one. They mentioned longitudinal studies following Canadian college students over time. Students involved in group physical activity and team sports reported better mental health than students doing individual activities.
Even if they did the same amount of exercise?
Yes. Regardless of the total volume of activity, The social connection seemed to be a powerful factor.
So community, belonging.
Exactly. The paper talks about psychological needs, autonomy, feeling competent, feeling related to others. Context delivers those things, or fails to, and that mediates the mental health outcome.
Wow. Okay, and you mentioned earlier, what about things that aren't exercise at all?
Right. The paper makes this great point. Think about many really effective psychosocial therapies for mental health. Talking therapy, support groups, mindfulness training.
They're often done sitting down,
Yeah.
sedentary.
Totally sedentary. They work entirely through contextual factors, discussion, reflection, learning coping skills, building relationships, setting goals. If context alone could be that powerful without movement.
Imagine combining positive context with movement.
That's the implication. The potential could be much greater.
So how much does context really add? Is there a way to quantify it?
Well, one meta-analysis they cited tried to get at this, looking at ADHD symptoms again.
Okay.
When they compared exercise trials to groups doing nothing, no intervention, they saw a moderate effect. Exercise plus context seemed helpful compared to nothing.
Makes sense.
But when they compared exercise trials to active comparison groups, groups doing something else like maybe arts and crafts, where many contextual factors like group setting, instructor attention, routine might be similar.
What happened then?
The effect size of the exercise itself was much smaller, suggesting that maybe around half of the mental health benefit we often attribute just to exercise in those studies might actually be coming from these contextual factors, the social support, the sense of mastery, the routine, the expectation.
Wow, half. That's huge.
It really shifts the perspective, doesn't it?
It absolutely does. Okay, so let's unpack the implications here. If context matters this much, how should we think about exercise for mental health going forward? It's clearly not just about hitting 10,000 steps anymore.
Not at all. The big takeaway is really about tailoring, customization. Instead of some universal prescription, like 30 minutes 3 times a week, the findings strongly suggest we should focus on fitting activity to the individual. What do you enjoy? What social settings work for you? What environment feels good to you?
Find your joy in movement, basically.
Find your joy, find positive social connection, find that sense of achievement or competence. Leaning into those personal preferences and positive context seems crucial for enhancing the mental health payoff.
And this connects back to the bigger picture too, right? The paper mentioned public health.
Yes, importantly, it grounds this in reality. Mental health is a massive public health issue, complex with deep roots.
Right.
And physical activity, while beneficial, isn't a magic bullet. It doesn't erase poverty or inequality or lack of opportunity, things that profoundly impact mental well-being.
So we need realistic expectations.
Definitely. But it also opens up thinking about how we integrate activity into addressing those bigger issues.
Like what? How could that work?
Well, the paper hints at things like, when we think about affordable housing, can we also ensure there's access to safe, appealing green spaces for people to move?
Okay, building context into infrastructure.
Or could we link physical activity initiatives with efforts to tackle food insecurity? Maybe through community gardens, which offer both movement and fresh food.
Interesting. Connecting the dots.
Exactly. The conclusion, really, is that to maximize the promise of physical activity for mental health, we have to get much better at understanding and deliberately using all parts of the experience, especially these vital contextual factors.
So the call to action for you, the listener, is?
It's an invitation, really, to think beyond just if you move or how much. Think about how that movement feels. What context surrounds it? Is it draining you or is it uplifting you? And how can you intentionally build more positive, supportive context around the ways you choose to move your body? That seems to be where the real power lies for mental well-being.
That was a really, really insightful deep dive. It takes us way beyond just move, more into this much richer understanding of context, connection, and feeling.
Absolutely. And understanding these nuances, I think, really empowers all of us. We can make choices about activity that are not just about physical health, but are truly aimed at boosting our mental well-being in a more profound way.
Well, thank you for joining us for this deep dive. We really hope it's giving you, our listeners, a lot to chew on as you consider your own relationship with physical activity and its role in your overall mental health.
Food for thought, definitely.
So maybe the next time you think about exercising, you'll ask yourself not just how long or how hard, but also who am I with? Where am I doing this? And maybe most importantly, does this actually bring me joy?
Thanks for tuning in to the Health Headliner podcast by To Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.